Hi, it's Jane, and today on Healthier You, and this is 50 Gone by 2025, I was asked to do a topic, and I have heard of this, but I've never had a patient that had this, so I thought I would do a little research into it, and it is hyperinsulinemia. This is is it a form of diabetes? I don't know. Let's get into that. Anyway, let's get into the medical disclaimer. Always check with your physician before starting any exercise or dietary program. Information here is my personal research into different health topics and is not to be considered medical advice. So, let's get into it. Is hyperinsulinemia a form of diabetes? Hyperinsulinemia means the amount of insulin in the blood is higher than what's considered healthy. On its own, hyperinsulinemia isn't diabetes, but hyperinsulinemia is often associated with type 2 diabetes. Insulin is a hormone that the pancreas make, and it helps to control your blood sugars. Hyperinsulinemia is connected to insulin resistance, a condition in which the body doesn't respond as it should to the effects of insulin. In that situation, the pancreas make more insulin in order to overcome the resistance, leading to higher levels of insulin in the blood. Type 2 diabetes develops when the pancreas can no longer make the large amounts of insulin needed to keep blood sugar at a healthy level. Rarely is hyperinsulinemia caused by a tumor of cells in the pancreas that make insulin. These tumors are all called insulinomas. Too many cells in the pancreas that make insulin or too much growth of these cells. This condition is called nocidioblastosis. Hyperinsulinemia usually doesn't cause symptoms in people with insulin resistance. People who have insulinomas, hyperinsulinemia, may lead to low blood sugar called hypoglycemia. Treatment of hyperinsulinemia is directed at the problem it's causing. So what happens is you're going to have abnormally high levels of insulin in your body. So that's going to affect your blood sugars levels, and it does have very strong links to type 2 diabetes. It can also lead to hypoglycemia, which is abnormally low blood sugars, which is still a strong sign of diabetes, but is a separate condition. So what is it? Hyperinsulinemia, your pancreas create too much of the hormone insulin. That hormone helps maintain your blood sugar levels. So hyperinsulinemia occurs due to insulin resistance, and insulin resistance is when the body does not respond to the effects of insulin as it should. So your pancreas create more insulin to compensate. So what are some of the symptoms? Hyperinsulinemia does not have any noticeable symptoms. However, if it leads to hypoglycemia, which is an extremely low blood sugar, it may cause sugar cravings, unintentional weight gain, excessive hunger, issues with concentration, anxiety or feelings of panic, extreme tiredness. Symptoms in infants and young children may include difficulty feeding, extreme irritability, lethargy, or no energy. So what are some of the risk factors and causes? Typical cause of hyperinsulinemia is that insulin resistance. Insulin resistance is what happens when your body doesn't respond correctly to the insulin. This incorrect response causes your pancreas to produce even more insulin. As your pancreas make more insulin, your body continues to resist and respond incorrectly to those higher insulin levels. Your pancreas will continually need to make more to compensate. Eventually, your pancreas won't be able to keep up with the amount of insulin your body needs to keep your blood sugar at healthy levels. Insulin resistance can eventually lead to type 2 diabetes. 2021 research suggests that hyperinsulinemia may actually cause insulin resistance and not the other way around. Less common causes are that insulinoma and the nocidioblastosis. Insulinoma is a rare tumor of the pancreas cells that produces insulin. Nocidioblastosis is when the pancreas produces too many cells that make insulin. Hyperinsulinemia may develop after having gastric bypass surgery. The theory is that the cells have become too large and active for the body, but the body has changed significantly after the bypass. Doctors aren't fully sure why this happens. So what are some of the risk factors for it? Hypertension, high levels of visceral fat, obesity. Environmental, genetic, and socioeconomic factors can also affect someone's chances of developing hyperinsulinemia. 2019 research review found that racial differences in insulin secretion and clearance rates meant that Black and Hispanic children have a higher likelihood of developing hyperinsulinemia than white children. Differences in dietary habits, economic status, and exposure to pollutants are also risk factors that vary between social and racial groups. So how is it diagnosed? Doctors typically diagnose hyperinsulinemia with a fasting blood test. With the results, they will measure your insulin and blood glucose levels. If your levels are above the typical ranges for your health status, a doctor may diagnose hyperinsulinemia. What are the treatment options? Treatment for hyperinsulinemia begins by treating its underlying cause, such as insulin resistance, insulinoma, or that nocidioblastosis. And some of the other ways they may treat it include increasing your insulin clearance, maximizing insulin sensitivity, reducing calorie intake if that does apply to you. Your treatment may also be a combination of lifestyle changes, medications, and possibly surgery. Some lifestyle changes will include diet and exercise. Diet to treat insulin resistance, which I think will effectively treat that hyperinsulinemia if you do have it. Which are a well-balanced diet can help you better regulate your body's overall functioning and reduce excess body weight. It may also help regulate your glucose and insulin levels. Any diet that helps people reach and maintain moderate weight can be beneficial in managing insulin levels. So eating a balanced diet rich in nutrient-dense foods is typically the best means of reducing and maintaining weight. Diet to manage blood sugar. As hyperinsulinemia affects your blood sugar levels, it can be beneficial to follow a plan that also helps manage those levels. One way to help with blood sugar management is to prioritize eating foods that are low on the glycemic index. There are currently 3 preferred diets for glycemic control and treating hyperinsulinemia: the Mediterranean diet, a low-fat diet, and a low-carbohydrate diet. Each diet consists primarily of fruits, whole grains, vegetables, fiber, healthy fats, and lean meats. Be sure to discuss those changes with your doctors before beginning a new eating plan. Following any one of those diet plans may help with that glycemic control which can improve your body's insulin response. Exercise to treat insulin resistance. Any physical activity can improve your body's sensitivity to insulin. This reduces insulin resistance, which is the most common cause of hyperinsulinemia. Exercise can also help reduce obesity, which may be an underlying cause of this condition for some people. There are many forms of exercise, each with different benefits, but all activities can help in reducing visceral fat, reaching a moderate weight, and regulating insulin sensitivity. Resistance. Resistance exercise aims to increase strength and endurance. This often involves lifting weights, but you can also do body weight exercises instead. Aerobic exercise is an activity that increases cardiovascular exertion. People often refer to this as cardio, which includes walking, jogging, or swimming. High-intensity interval training involves cycling between short periods of high-intensity activity and short periods of low-intensity rest. This is a specific form of aerobic exercise. You should discuss what type of exercise is best for you with your doctor. This is because some exercises or the intensity of some exercises may not be suitable for everyone. Medications for diabetes and low blood sugar. Doctors do not typically recommend medications for hyperinsulinemia. Lifestyle modifications are the primary treatment course. However, doctors may recommend medications to treat associated type 2 diabetes or prevent hypoglycemia. The most common drug for managing type 2 diabetes is metformin. This drug reduces the amount of glucose the body produces, preventing hyperglycemia. Some medications can make this condition worse. It's important that all your doctors are aware of every medication you take and all your medical conditions, including over-the-counter drugs, over-the-counter supplements. Be sure that your doctor knows this. Are there any complications with this condition? Hyperinsulinemia causes low blood sugar, which is hypoglycemia. Low blood sugar can lead to several serious complications, such as seizures. If your blood sugar gets too low, you'll automatically go into a seizure. Can cause coma if it continues to stay low. Cognitive function issues, especially in young children. Hypoglycemia is more common in insulinoma and nocidioblastosis than other causes of hyperinsulinemia. It can be managed, but it's important to have regular checkups with your doctor. Those checkups also allow for a timely diagnosis. The earlier hyperinsulinemia is diagnosed and treated, the less likely you will develop serious issues. Now, some of the more clinical things that are related to it are, it is a hepatic metabolic clearance of insulin in subnormal fasting glucose and obesity. However, it's often associated with physical fitness and metabolic health. Aging is associated with that, as well as clearance of insulin of the hyperinsulinemia. You may find that blacks have a higher incidence of higher level insulins than whites, and a lower fasting C-peptide, which is consistent with impaired insulin clearance in blacks. Could be explained by differences in BMI, family history, smoking, or any other factors. There are a lot of factors. So there is that ethnic component that is there, which you can't change your ethnicity. You can change your weight, change your hair color, change your telephone number, but you can't change your ethnicity. Diet is usually the first thing that they want to do. There are some different studies that they can do to find out if you do have hyperinsulinemia. One of the things that I do know is someone who has hyperinsulinemia, and if they are having a lot of hypoglycemic episodes, they most likely should be carrying glucagon on them. And glucagon is something, it's just pure sugar is what it is. And there are, even Walmart and Target carry them. And they are little candies that you can chew on that give you about 60 calories of sugar at a whack each chew. For someone who has gone into a seizure, and I have seen a doctor do this, what he has done before is taken packets of sugar and open up those packets and slip it in between the tongue and underneath the tongue and the lower palate. Someone who is having a seizure or is close to a coma, this sometimes will help because it's more instantly absorbed by your body, 2 places, under your tongue, which is why many times when you do take a medication for cardiac issues, they tell you put it under your tongue. It's absorbed more quickly. The other place is sticking it up inside the vagina or the anus. Those are very 2 good porous 3 places that react the fastest with medications. And I have given pain medications anally before to help get it absorbed faster with someone who has been in extreme intense pain. So yeah, it does work, but I wouldn't do it unless you are a trained medical personnel. But someone who has hyperinsulinemia, most likely they're going to be carrying around packets that can be administered quickly, even a shot of pure sugar that can be injected quickly into the system. But it's something that needs to be watched closely and needs to be watched by a doctor. So it's an interesting topic. I'm glad that you brought it to my attention. Like I said, I do know a lot of people who are diagnosed with hyperglycemia or hypoglycemia, and many times these people carry around snacks with them. They'll eat every 2 hours, small snacks, those kind of things, to keep their blood sugars level. So there it is in a nutshell, okay? I don't know if it helped anyone, but it is an interesting topic. All right, guys, that is it for today's video. As you can see, I did just film from same film fitting yesterday. So I hope you did enjoy it. And as always, remember to be a little kinder to yourself, love one another, get in touch with God today, and I'll see you again next week. Bye.